Hello, everybody. This is Johanna Ralston from the World Obesity Federation. Welcome to everyone on this wonderful Thursday in June. We really joined us. Next slide, please. Today, we're going to be focusing on patients and people living with obesity. We've called this webinar a Global Patient Network, as we'll be taking a look at the networks of patient organizations, individuals, and coalitions that have been evolving over the globe in recent years to support people living with obesity. We're also at patient initiatives across the globe, which will hopefully inspire listeners who are considering getting involved with patient support and advocacy. As you can see on the screen, we have an agenda. We've got a very with 3 fantastic speakers from our patient groups, as well as another report back from Fiona Montague, who's leading our membership for World Obesity Federation. So we've got a lot to cover in a very short time. I will try to keep the, but just tell you that we want to please keep sending us your news and updates so that we can share these with our networks. And we're very excited about how the obesity community is affected by obesity. In addition to our speakers from India, North America, and Europe, we want to update you on the World Obesity Federation work on creating a global patient network. The aim of this is to provide a hub for patients around the world to network and showcase your activities and provide a platform for people living with obesity. Over the longer term, we're also interested in working with people to advocate for more focus on obesity. Apologies, there's a siren in the background here. This is an emergency to focus on obesity at the World Health Organization, which we will cover in a later webinar. Take a brief look at the work we're undertaking in the Middle East and North Africa with our MENA, that's Middle East North Africa Patient Engagement Program. Today we'll begin with Dr. Asta Shug, who is Research Associate at India. RIDE is an organization based in New Delhi and focuses on research, capacity building, and campaigns linked to the prevention and control of non-communicable diseases, or NCDs, including cancer, cardiovascular disease, diabetes, chronic respiratory disease, and of course, obesity. Asa will talk to us about RIDE campaigns and training work engagement. We'll then hear from Christy Kuna, Vice President of Programs and Operations at the Obesity Action Coalition, based in the US, which over the years has done some great work on patient advocacy. And we'll hear how OAC has evolved and an overview of its education, advocacy, and support activities. Christy will be followed by Susie Burney, who is the Association for the Study of Obesity in Ireland patient representative, and she is also now secretary of the recently launched European Coalition for People Living with Obesity, ECPO, which was launched by EASO, the European Association for the Study of Obesity. And we'll hear about Susie's personal journey and the broader activities in Europe. Finally, again, Fiona Montague, who's program membership manager here at WOC, will be speaking about our patient engagement programs. So as usual, we want to make the webinar as interactive as possible. After each talk, please do type in your questions. We'll Q&A, and then 5 minutes at the end for any final questions. Some quick housekeeping, as you can see on this slide. Everyone should be muted at all times unless you are a presenter, and you'll see the little mute signal on your screens. If you have questions, and we really want, they're the only silly question is the one you don't ask, right? So please, please, please ask questions. Please click on the Q&A and type a question in the question box. We'll do our best to answer these, and if we can't answer it, we'll follow up with the speakers. There's a handout of our presentations, and we'll also add slides to our website where you can access them. We are recording the webinar, and we'll send a link to everyone after the webinar has taken place. So it is my great pleasure to introduce Dr. Asta Shug at RIDE. Over to you, Asta.
Hi, everyone. I hope you can hear me. So just to introduce myself, my name is Asta Chug, and I'm working as a research associate with RIDE. And I'll be talking meaningful engagement of people living with NCDs in action and advocacy for NCDs and control, NCD prevention and control in India, and RIDE's experience and patients living with NCDs. Next slide, please. So Just giving a brief introduction about RIDE. RIDE is a not-for-profit organization of public health researchers, advocates, social scientists, engaged in active health awareness and informed health activism amongst youth in India since 1992. At RIDE, we work on a number of things, including research, and enable patient living with NCDs and also youth. And we do a lot of advocacy. We forge partnership with our various members, network alliances, with the multiple stakeholders, including civil society, build capacity of diverse stakeholders to effectively address national health challenges through government programs and policies. We also convene a lot of multi-sectoral consultations and conferences with a focus on prevention and control of NCDs. And within NCDs, we work on specific key areas, which include tobacco control, nutrition, and physical activity, through which we target obesity. And then we work on alcohol control, protection, mental health, hygiene and sanitation, prevention of HIV and AIDS. So we work on a lot of focus areas, and we also serve as the Secretariat for Advocacy Forum for Tobacco Control, and also HIA, which is the India NCD Alliance, about which I'll be talking a lot in detail, because we have worked with our patient engagement work we have done with the HIA itself. And also the India Network for NCDs and Youth, which is a very new network in which we have youth advocates which are advocating for NCD prevention in youth. Next slide, please. So Healthy India Alliance, which is the India NCD Alliance, was established in 2015 and is a coalition of 14 civil society organizations in India. HIA works to foster engagement of multi-sectoral civil society organizations to tackle NCDs as a whole by generating awareness, building capacity, and empowering patients. Health promotion. Our mission is to just work for NCD prevention and control through various perspectives, and there are a number of organizations which are involved as a partner of HIA, and we all work together from different regions of India, and we work together on various perspectives of NCD prevention and control. Next slide, please. So as a part of this HIA, we have conducted various national civil society consultations on NCDs in India. There has been 2 specific national civil society consultations which were held in 2015, and the next one was held in 2017, which provided civil society or capacity building, information sharing, and networking session. The consultation witnessed pan-India participation from approximately 90 multi-sectoral partners from both health and non-health departments and different regions, working on issues directly or indirectly related to NCDs. These consultations also seek support Ministry of Health, Government of India, and World Health Organization Country Office for India, and also Southeast Asia Region Office. And next slide, please. We have also conducted various regional civil society in which 41 state-level civil society organizations participated. These regional consultations aimed at sensitizing grassroots level organizations on health and development aspects of NCDs. And these consultations also provided sub-national perspective, highlighting their needs and priorities, challenges in advancing NCD agenda, and support requested from central and state government. So these were very useful to get some regional perspective from different states of India. Slide, please. So talking about the patient living with NCDs work, RIDE has worked in collaboration with HIA and NCD Alliance to the initiative, which is called OVOV, which was led by NCD Alliance. As a part of this initiative, 5 community conversations were held in India with patients living with NCD, patients and caregivers in 4 different regions of India. It happened in 2016. The intent of these community conversations were to identify the needs, challenges, and priorities of patients living with NCDs. And to do these conversations in India, 4 of our HIA members participated in the OVOV workshop, which were organized in Geneva, and they were to the community conversations in India by the NCD Alliance. And this, the community conversation actually fed into a document which was used to develop the global advocacy agenda of patients living with NCDs by the NCD Alliance. Next slide, please. And a micro documentary on patient living with NCDs were also made, which was filmed in India, and it Alzheimer's and Related Disorders Society of India, in which the patients actually shared their experiences and as a caregiver who had early onset of for the family members who had early onset of dementia, and these documentaries were also used within the global NCD agenda. Next slide, please. To get a regional perspective, we also organize regional consultations to meaningfully engage patients living with NCDs, and this engagement was also helpful to feed the agenda of patient living with NCDs. So there's a global advocacy agenda which was made by the NCD Alliance, but the community conversations that we and Hriday, a national advocacy agenda is being drafted, which will be in public domain very soon, and making dedicated efforts to establish a national network of patients living with NCDs. There are specific region-specific cohorts that we have been following with the patient living with NCDs, but now we are trying to, make these groups together and trying to make a national network of patients living with NCDs, which is currently not in India. So we are definitely working on this, and a national lead into the progress of this this network that we are planning to form in future. Next slide, please. Apart from this, HIA and Hriday have done a lot of activities aligning with the global campaigns, and one of this was the Walk the Talk. So in India, we aligning Walk the Talk, we organized Youth Walk the Talk in various schools of Delhi, in which students participated, and there was a lot of social media buzz around India to, just to make an impact, just importance of fighting against NCD and saying enough NCDs. So this was something that we did aligning with the global campaign. Next slide, please. So currently, HIA is participating in OVOV Train the Trainers program, which is organized by the NCD Alliance in Geneva. And HIA is, after learning from these OVOV Train the Trainer program, we are trying to make a national network of people living with NCDs that I just highlighted. And these will be organized in India between July to December 2019. Because we do not have a specific focus on any particular NCD right now, so we would like to highlight some of the diseases like mental health, obesity in these workshops, in which we can collate, we can just invite people from a particular people who are suffering from a particular condition, and they can talk about it. So that's what we are trying, that's what we are planning to do in future. And that's it from me now. And if anyone has any questions, thank you.
Thank you very much, Asta. That was excellent. Really interesting to hear what's going on in India. I have a couple of questions have come up. Well, first of all, I wanted to mention that World Obesity Federation, we have our SCOPE training program for obesity and among health professionals, and we're launching one around childhood obesity, which will be piloted in India in October, working with something with Monica Arora, who's the head of Hriday. So because I think that India has the second highest number of children with obesity, if I'm not mistaken, after China, partly because of the population of the country, but childhood obesity has become a very significant challenge, I know, in India. And I guess one question that I have for you is how are you finding sort of the response to childhood obesity, and is that different to the response to the growing challenge of adult obesity in India?
So with the child obesity, the problem is like having, if a child is overweight, it's people don't take it seriously. Like they are just more, the culture barriers are more towards childhood obesity and the availability of food that the children are consuming at the moment in India. It's quite concerning. So, and also like even the homemade food, if we cannot change the cultural perspectives of the people, it's very difficult to just to go to people and tell them not to use too much oil in their food or something at their home. So that is quite challenging when we try to address childhood obesity. And also I feel like the stigma attached to obesity, it starts very it starts very early in life. I myself have been suffering from obesity, and there's a lot of stigma from the society, from the from the environment in which we live. So childhood obesity is definitely something which should be focused in India. And I've been working with Monica, and we have been talking about like how we can address childhood obesity, and we have done a lot of research in that area. But something related with advocacy, it would be very interesting, and that's something that we would like to do in future.
Excellent, thank you. One more question has come in, and then we're going to probably need to go on after that, but thanks. The question is, from your perspective, which social media platform was the most effective in some of the work that you've been doing using social media, and why do you think it was so successful?
Yeah, so a lot of work with youth, and for that Instagram is being very successful to reach to youth, and Twitter has been very effective in reaching to the policy makers and also the civil society organizations. So these two kind of reaching to the audience that we wanted to target, but it definitely depends upon our target audience. If we are if we are focus on the youth and we want to spread the awareness regarding controlling the childhood obesity, and if we want to reach more of the community, then something like Twitter has been very effective, something like Instagram has been very effective. But while going for the policymaker and government and civil society organization, Twitter has been very effective.
Okay, Instagram and Twitter, great. Thank you very much, really helpful. Thank you so much. Now it's a pleasure to introduce who is with the Obesity Action Coalition. Go ahead, Christy.
Great. Thank you so much, Johanna. Everyone can hear me okay?
Yes.
Great. Excellent. Well, thank you so much for allowing the OAC to share our experience in building the OAC. So as Johanna mentioned, my name is Christy Kuna. I'm the Vice President of Programs and Operations with the OAC, and I've had the privilege of being part of the organization since the beginning, helping build it from the ground up, which really was a daunting task looking back at our existence so far, but great progress we've made, and so I'm really excited to share that with each and every one of you today. So next slide. So for those who aren't familiar, the Obesity Action Coalition is a 501c3 charity that is based in the United States, and we're dedicated to educating and advocating for all individuals who are affected by the disease of obesity. The OAC strongly believes that obesity is a disease. We have held this position since the very beginning, and that's where we stand with that. We currently have more than 64,000 members throughout the United States. We also have members internationally as well, but we are really focused in the U.S. specifically. And our mission is to elevate and empower those who are affected by obesity through education, advocacy, and support. And today I'll just give you a small glimpse of these activities and how we do what we do through all of our efforts. Next slide. So the OAC has been around since 2005, and kind of the short story is that we were created after an elected official stood up at a Women in Government meeting and basically said that I could eliminate all coverage of obesity treatment, and I could enact laws that harmed people with obesity, and not one single person would come marching on my doorstep. And so that really resonated with a lot of folks, and there was definitely that glaring need to create an organization that stood up for the person who was affected by obesity. So the obesity rates rising here in the U.S., I know globally, it was pretty baffling that that there was no group that represented obesity as a disease. And so the OAC was formed shortly after this, and we have been around for 14 years. In that 14 years, I can tell you that the landscape in obesity here in the U.S. has changed dramatically, likely globally as well for colleagues on the line. But it's been an interesting journey so far just to see where we've evolved, and I really want to think about all the progress that we've been able to make collectively through our partnerships with groups on this line and in other respects. But really the patient voice, I think, is now more represented than ever in the U.S., and I'm also thinking that globally as well, so that's encouraging. So we are an established organization, and we do have a board of directors who manages us, and we're 15 members on our board. They all have personal and professional experience with obesity. Majority of our board members are personally affected, have been on a journey with weight, and undergone treatment. We also have 11 staff members with the OAC, and we have a full-time policy consultant in Washington, D.C. that really helps us keep our eyes and ears on policy initiatives. And Joe Naglaski, who's our president and CEO, which most of you probably have heard his name or heard him speak because he's all over. He spends quite an amount of time in D.C. Actually, he's there right now. So we're very well represented in that capacity. Next slide. So why do we exist? And I think this probably wouldn't surprise most on this line, but thinking back to 14 years ago, we really had to think about why is it this organization needs to form. At the time, there was no other group in the U.S. whose sole focus was representing individuals affected by obesity, and obviously that was a huge need. Here in the U.S., weight loss and obesity education is often very misleading. It's biased. The messages that are sent to the individual are very confusing, and so the OAC exists to kind of fill that need as well, to have credible education on weight and obesity. Weight bias continues to be a persistent and pervasive problem, and I think this not only speaks to U.S. but also globally as well. I think in all of my inner workings with our global colleagues, I think weight bias has remained one thing that unites us across the globe, and so one thing I think is a huge initiative we all want to see a difference in. And the fact that people need to address their obesity and their excess weight as a need, and they can't do that, is one of the really core reasons of why we exist. The fact that somebody has issues going to seek help for their obesity with insurance coverage and other barriers, this is something that is crucially needing to change, and so the OAC works on that. And we do have a strong belief that your weight matters for your health, and this is a brand that we developed several years ago, almost a decade ago, and has stood as a strong brand to really heighten this awareness around weight and its connection to health, and really focusing on that. Next slide. So in terms of what we actually do, so as mentioned, we were created to fill the advocacy gap for individuals who are affected. There was no group that did this in the U.S. Our goal really was to build this nationwide network of individuals. So when we were formed back in 2014, we had back in 2005, had to build every individual from the ground up. And we're proud to have 64,000 members nationwide. And it's tough for someone to stand up and say, I'd like to be a member of the Obesity Action Coalition. But we're seeing that change and folks really wanting to come into the fold. The more traction we've made in other ways with eliminating biases and making the awareness initiatives very strong. But our membership is a way that we build that nationwide network, but we do serve individuals in far greater capacities, not just in our membership. And I'll talk about that here in just a second. But we also, along with education, that we support a base in a good amount of advocacy, and our primary focuses are weight bias and improving access to care for the treatment of obesity. So the OAC strongly believes both in belief that treatment is often not discussed enough, and that's one of the focuses that we have in our advocacy efforts. Next slide. So just looking at the OAC, and this is just really a glimpse at the major activities. And I know you'll get these slide decks, but really this is to illustrate that when we had our very first member joined in 2005, you know, we had to build and do what we all of our needs in it for existence come alive. So, you know, looking into this, we've had some major wins throughout the years when it comes to bias initiatives, even some access initiatives as well. We have distributed well more than millions of educational resources nationwide. We distribute all of our resources for free to individuals who need it. We're very active in policy with the FDA here in the United States. We have a national initiative that we've launched. So this is really just to give you a glimpse at, you know, the monumental successes we've had, and our national convention that we host each and every year that began in 2012 is represented as well. But really, when you look at this 50,000 member number that's on the screen, is that, you know, when we started out, we thought, you know, we really need to build our coalition to be at least 50,000 members, because that is the number that it takes here in the U.S. to get people to take notice, elected officials, to know that this is that they need to listen to. Well, we're well past 50,000 members now, but that was our number. So now what we're really focusing our efforts on is creating that engaged network of individuals. So having a great number of members is fantastic, but beyond that, what does that mean? And so that's one of our focuses that's been in the past several years beyond this 2015 is how can we make this an engaged group? So next slide. And so last year in 2018, in looking at this opportunity for us to really create a more engaged group, that, you know, it's great to have a lot of members, but we really want members who are actively doing things. We shifted our approach to having a more community approach to our membership, where it became a lot more inclusive. It became a great mechanism for us to be able to really provide solid programs to get people to really stand up and raise how to do that. So this happened just last year, which we were very proud of, and we've seen some great progress and success even in this short period from doing that. So more to come on that. Next slide. So I'm going to talk a little bit now about our education, advocacy, and support efforts. These are the pillars of our mission. Next slide. So with our educational efforts, we do patient education. As mentioned before, the type of education that's out there really does needs to be reviewed, and there's so many messages that folks are receiving on a daily basis, and the education out there that is biased. And so we pride ourselves on offering a variety of diverse educational resources on obesity, treatment bias, related conditions, and so much more. All of our education is accessible via our website. So that you can receive is on the website in downloadable formats. Our goal is to get our education out there to those who need it. And again, you can contact national office here. We do all of our resources, and this is one of the main things we do to serve individuals. The materials that we create that we have are written for the patient. This was always an issue too, where patients were not able to really understand some of the information out there. There's a great information out there, but the OAC prides ourselves on creating this information at an easy to understand level for the patient. And we also focused on having some new resources to help individuals finding the right healthcare provider. That remains a persistent problem here in the U.S., is that people who are ready to have the conversation about their weight go to a provider, and that provider is not equipped or able to really sensitively handle the subject of obesity, believe it or not. So one of the things we do is having resources to help people know what to look for, but also how to find the right healthcare provider. One of the things to mention, too, that's noteworthy is our awareness initiatives. The Your Weight Matters campaign that we have is actually an awareness campaign that we do. It's focused really in the awareness of weight and health go hand in hand, and to talk to a provider about this, about your weight. And it's a very and hundreds of people each and every month to us, just who are really looking for more information and wanting to take a challenge to really start talking about this concept of weight. And so this awareness initiative is great, but having that resource to help them find the ready to take that step is crucial. So it's nice to have those resources go hand in hand. Next slide. And so, as mentioned, we back in 2012, we knew that for the longest time since we were formed that we needed to have a place where our members and patients come together in one place. And so in 2012, this became a reality. We created the Your Weight Matters Convention and Expo. And again, this is based on the Your Weight Matters brand to really bring in the everyday individual to learn evidence strategies from the leading experts, and so we truly do have the leading experts. So we successfully held 7 meetings. We're about to host our 8th annual meeting that is coming up in I do encourage anyone who's interested in the topics or the scope of what we present to visit ywmconvention.com, and this website will tell you a lot more about this event. But we have actually seen an increase international participants, everyday people who fly thousands of miles to come to this convention. We draw about 600 people here in the U.S., but it's a very powerful event. It's our platform to really having the quality education that we believe in, as well as engaging people in these broader issues. So definitely encourage you to check this out, and we're very excited each and every year to host this meeting. Next slide. So in terms of our advocacy, I'm going to talk about 2 of our key issues. We obviously work on we focus a lot of our efforts on are improving access to care and bias and eliminating bias. And so I'll talk to you a little bit about improving access and how we go about doing this. So the first and foremost, patients have a hard time understanding insurance policies. We get calls all the time for folks who are needing to get access to treatment, to their care, and they don't know where to start. Their insurance might also exclude it. They need help with appealing, so we do work and help with patients to understand the process and such. We also, on a policy front, we are working on key legislation that expands coverage of obesity treatment. It's called the Treat and Reduce Obesity Act here in the U.S. It's been a long effort that has that we have seen some successes and fallbacks, but I think that we're actually seeing more successes in the passage of this, hopefully coming in the near future. This is key legislation that would allow individuals to have expanded coverage to a multitude of services. Bariatric surgery, obviously one, but access to nutrition counseling, pharmacotherapy, things of that nature for our Medicare population. So this is really key legislation we've been working on. We also educate elected officials on the importance of obesity treatment. We conduct a lot of legislative visits accordingly on this, working with employers on increasing coverage of obesity treatments. Again, working a lot to show the impact that this makes on the individual, letting those patients' stories be heard. And then we also have some reporting tools that allows our members to share their issues with access. And that helps us keep a pulse on where we need to be and focusing our efforts and taking on certain other issues when it comes to access. Next slide. In terms of bias, I think we could probably talk a lot about this, and I think these images probably lend a lot of intrigue by everyone, but the OAC obviously firmly wants to see the elimination of weight bias in our society. Our strong belief is that bias is have better coverage and better access to care for individuals with obesity. So we see these issues pretty hand in hand. But the OAC ignites its membership to fight issues when we see them. And we also do proactive ensure that people with obesity are well represented and heard in the right ways. So these couple images are just some issues that the OAC has tackled on more of a public nature. I can say that these were issues that we had seen success in combating. The first one, Save the Whales, was a billboard by a radical group here in the U.S. for called PETA, and we actually, our members lobbied this group in terms of sending them letters, angry letters about this billboard that really was on the highway. I'm proud to say that we did get them to remove this billboard. They did put one up in return that wasn't stigmatizing, but it was a message that, you know, still kind of held to their belief of what they did was okay. But we were very happy to see this Save the Whales, which was horrifically seen on a highway, removed, and that was a great success for us. The other one that to highlight is our, back several years ago, one of the insurance providers here in the U.S. was trying to require IQ testing for those who are trying to get weight loss surgery. There was no other disease that ever required that. I think this goes on the assumption of people with obesity are not intelligent and all the stigma that that has been brought about with that. We this policy, which was a huge win, and it was one that really riled up our members. And the your abs on cheese and your thighs on cheese, that was an advertising campaign as well that we took on, that we saw good success in removing. But the sad thing is that these things are that the companies actually put these messages out there thinking they're appropriate, thinking that this isn't harmful to the people who are struggling with this. So the OAC is here to stand up, and our members are here to stand up against this. So we've done a lot more. So if you go to our website, you can certainly see the host of issues we've taken on. So just to close here, and then the last couple of slides, I'm going to talk to you a little bit about our community. So next slide. Our community is a vibrant community of people. Our community is and further our mission and goals. We want them to connect with one another. We have various programs where we do this, where we have an action program to take on these issues I was talking about. We have a personal story sharing platform. The OAC's community is truly a very diverse group of individuals doing a lot of diverse things. Next slide. Uses a portal of our membership portal, which is a sneak peek at this. And there's a lot of ways to connect in here. You can access this without being part of our community. There's no charge to being a member of the OAC. So definitely take a peek at this after this webinar. Next slide. I've talked to you a little bit about the Way to the World the Way to the World platform, and that's also another web. And this is a place where people can go and share their honest and real stories on their journey with weight. And our action program is another one where we engage our members in taking on these key issues, whether it's for access, bias, or any issue that is harmful to people with obesity. Next slide. So that, I was running short on time, so I kind of blew through those last. But again, check out our website at obesityaction.org, our convention website as well, and there's a lot to take in, and with anyone after for any questions.
Thank you so much, Christy. That was excellent. That was really, really great. We already had a question from Donna Ryan, who is the president of World Obesity Federation, who is on the call as well. Again, applauds the great success that OAC has had, and wondered what advice would you have for starting a new organization in another country?
Oh, that's a great question. So I think that any organization who's starting out or wanting to start out is to it was a slow burn for the OAC in the beginning, but I think participating in things of this nature, networking with other organizations, the OAC is big on partnership, and we strongly believe that these connections that we make through things like this are really helpful to build that network of individuals. And it really does take finding those really key people who have loud voices to start and bring along other patients as well. So I think patience is going to be one, and then keep collaborating and partnering with other groups as well as another.
Great. You made a little bit of a pun there, having patience.
Very true.
And I think it's true that champions are key, just finding the really loud, courageous, wonderful people who can help plant the seeds and get something going. And as we'd heard in the previous section on the whole global NCD movement, there were, that's also driven by, strong champions as well. So thank you so much, Christy. This was excellent, and people have a way of getting in touch with you afterwards if they want more information. It's
definitely. Thank you so much.
Thanks. And now it's my great pleasure to introduce, speaking of champions, Susie Burney, who is with the representing us today as the secretary of the new European Coalition for People Living with Obesity. So without any further ado, Susie, please jump in.
Hello, everyone. I'm Susie. I'm living in Dublin. I'm honoured to be here and share my experience of living with obesity. I'm a little nervous, but luckily you all cannot see it. I'm not medically trained on obesity and I'm not a professional, but I am an expert on living with obesity. And I debated whether to use before and after photos because we all know what somebody living with obesity looks like, but you don't know me. And they do help paint a picture of my life living with obesity. Sometimes words don't convey what living life at 150 kilos was like. Please. My problems with weight didn't begin until my teens, but it wasn't the first problem I faced. I have a condition called selective eating disorder, or it's otherwise known as avoidant restrictive food intake disorder. This condition is commonly linked with symptoms of OCD, sensory issues, and neophobia. From the age of 2, I refused most foods. I feel disgust and repulsion towards majority of foods. This can be the smell, the look, the texture, or taste. My safe foods are bread, chicken, milk, eggs, and cheese. I can't eat any vegetables, fruit, sauces, hot drinks, and many more. My comfort foods were crisps, bread, and biscuits. But the complications don't stop at how I feel about food itself. I won't use food from different packets, and I will scrutinise use-by dates. To me, food often looks contaminated, and when trying new foods, I'd freeze, sweat, cry, vomit. Meal times were a constant battle to try and entice me to eat healthy meals. One time I did try vegetable soup, and my stomach just clenched and the soup came back up, and it was actually clear that I wasn't being fussy or spoiled. I really couldn't eat it. Which is ironic that I became morbidly obese despite having such a disinterest in food. I would hide my food at dinner time in my pockets and even in the curtains beside me, and then I'd get out of bed in the early hours of the morning to go and clean the mess. I was happy to go hungry at family meals, but then secretly eat snacks later. So food was a battle every single day, and it determined so much of what I did with my life and where I would go, because it's not easy to eat out when you have such disordered eating. I remember a relative asking me clearly, why couldn't I just be normal like everybody else? I kind of felt as a 10-year-old I was normal, but after that I started thinking about it. I was always very physically active, and I swam in competitions, swimming maybe 5 days a week. I played basketball, tennis, and I did martial arts. In my early 20s, I had a bad knee injury, and I had to stop all activities which caused me pain. And the only regular exercise I could manage was swimming, but my weight started to increase. To buy my own food that I would eat in secret. So I spent my 20s in denial, disordered eating, a huge decrease in physical activity, feelings of low self-worth, depression, all began my increase towards obesity. By the time I was 30 years old, I weighed around 150 kilos. I was told I was morbidly obese, a term that made me feel like I was a walking dead person. I was aware my health was seriously at risk. I was aware I couldn't run for a bus, but I could swim a mile 3 times a week. I could function very well day to day with this body that I had. My torture around me, it didn't spur me on to want to change. It ultimately led me to despise myself and give up trying time and time again. So living with obesity, you go through every single day anticipating, fearing, expecting, and preparing for the worst. Stares, comments, suggestions, and judgments. And it takes up every ounce of your emotional energy. This journey everybody talked about, which always felt too big a task to achieve. So I was referred to my weight management clinic in 2009 after being diagnosed with diabetes. With the help of the multidisciplinary team, I began to make slow lifestyle changes, and I was making a slow and steady weight loss, but despite these positive changes, I was diagnosed with diabetic retinopathy. And I was shocked because I was on 3 diabetic medications. How could I be deteriorating in health? I had assumed that medication was solving all of these problems. So I had to do something urgently, and I contacted my private health insurer. And after a long battle and explaining my spiraling health concerns, they finally agreed to pay for my surgery in full, which is really very rare in Ireland. So I had my gastric bypass in July 2000. Diabetes was reversed on the day, and I was taken off all medication. In the following year, I lost 80 kilos, and my retinopathy reversed. I was told at the time if I progressed to stage 2, it wouldn't have reversed regardless of surgery or weight loss. So I'd had my surgery just in time. I was asked once if I could summarize my life with obesity, which is a hard thing to do, but I thought of my Russian dolls. So next slide, please. I was the biggest doll. I nearly got down to the smallest doll, and I've now regained to be somewhere between the middle dolls. Regardless of what doll I am still the same person. I'm Susie. I have the same eyes, the same heart, the same sense of humor, the same brain, and the same feelings. And I'm likely to change dolls many times in the future, but I'll still be looking out at the world through these same eyes, and I can only wish people will look and treat me the same, whichever doll I am. The most important improvements, slide 5, sorry. The most important improvements for me was with my health and diabetes. But now I'm also able to do the things I've always wanted to do. I'm now living, and I'm doing what I really, really always wanted to do. Next slide. I'm not saying everyone who loses weight is going to jump out of a plane or hop on a motorbike. Far from it, but everyone deserves the chance to live the life that they want to live and not be restricted by their health or their body size. What I regularly heard from family and friends and colleagues was, could you not just try? Why don't you? And then it would be followed by a suggestion that seemed so easy to them, but was actually impossible. Such impact on others. I was often upset by words people used around me, particularly those closest to me and family. I knew they were worried and cared about me, but their words just angered me. I always felt I was at fault, and often stupid, because I wasn't doing what everyone suggested I do. Or if I was, nobody living with obesity wakes up and decides to live this life. Yet, it is the one condition that people in society feel they have a license to criticize and speak to you about. Would we ask someone with diabetes how their HbA1c levels are? Or would we ask someone with prostate cancer how their PSA levels are? Yet on a regular basis, I was asked what weight I was, what size clothes I was wearing, and most common, do you really want to eat that? I firmly believe that not battling obesity alone is the key. Patients need to share their experiences, and healthcare professionals need to listen and use that knowledge to create better practice in treating patients with obesity. During my time at the Weight Management Centre, I joined a private patient Facebook support group. I attended meetings, and the first time ever I was around people who understood, people who felt the pain and understood the isolation of living with obesity. And it was through this support group I asked questions and learned more than I ever did about obesity from patients' very own experiences. I became an administrator some years ago and started organising patient-led activities, family walks, healthy lunch meetings, and we are focusing on what we can do and not on what we can't, and we are trying to help ourselves and each other. So following that, I became a representative with the Association of Studies for Obesity Ireland, the ASOI. This is an Irish branch of the ASO. I have sat on their committee since late 2016, and I remember feeling intimidated and overwhelmed at how little I knew about obesity and what was happening in Ireland for treatment and care. And I still have a lot to learn, and the committee at ASOI have been so incredibly encouraging and supportive, which has led me to continue working to strengthen the patient voice and raise awareness that obesity is a chronic disease. We recently held our first big European Obesity Day event in conjunction with the ASOI annual conference. Next slide. Patients travelled from all over Ireland. We had 7 patients from Ireland giving their patient perspective after every speaker at the conference. And it was a proud moment, and it is the start of exciting changes that will happen for patients in Ireland as we work towards creating one national patient organisation. There are many patients who are doing fantastic work advocating locally, but however, one barrier we face is that due to stigma that is shown from society, many of these patients do not want to be involved publicly. It is difficult to ignore the regular comments of just eat less and move more. So in May, ECO and ICO 2020, this coming May in Dublin, it'll be hosted by ASO, the World Obesity Federation, and the ASOI. And our goal as Irish patients is to be alongside with patients from ECPO, sharing our patient experiences. What is ECPO? ECPO is the ASO European Coalition for People Living with Obesity, who recently European Congress on Obesity in Glasgow 2019. It was formerly the ASO Patient Council, which was first officially formed in 2014, where around 10 patient representatives met at the European Congress in Sofia, Bulgaria. These patients represented countries such as Portugal, Ireland, the UK, Iceland, Italy, and Poland, to name a few. The aim of the Patient Council was to work to help the European scientific and clinical community better understand the patient experience along the care pathway, and also to open conversation with the patients to get a clear understanding of the need of people with weight and help by putting the patient at the centre of all future projects. It has been incredibly busy since the launch, with a number of EU projects, global projects, and work at national levels. If you actually look at our social media accounts today, we have posted a short list of just a few of the events our members are involved in over the next 3 months. We have now grown to a total of approximately 22 countries represented and 35 individual patient representatives. We closed our most recent round of applications for new patient reps to take up vacant council seats, because soon we're going to have more than 40 patient representatives on our council. Rapidly, we'll be opening these positions again in time. Out of the 10 patients who first met 5 years ago, there are 7 still involved, sitting on the board of directors or executive council, and all are a vital part of the quickly expanding organisation we've now become. In July, our board and executive committees will be meeting and creating our strategy plan for the immediate and distant future. Our communications committee are working tirelessly on our social media accounts and getting our website launched very soon. What are the barriers we face? Well, we're also eager to get so much work done, but we're mindful that most of us involved are giving up so much of our valuable time to make eCPO what it is. However, the dedication and commitment of our Executive Director, Vicky Mooney, our President, Solveig Sigurdur, and Vice President, Audrey Roberts, and the time they give to eCPO has been contagious. There is excitement and eagerness for patients to get so much done, and we will. Next slide, please. What do we do at eCPO? The various national representatives serve to promote the needs and interests of our European patient community across a broad range of stakeholder communities and act as an advocacy posture for patient concerns. The leadership committees foster advocacy, encourages networks between and among patients, scientific groups, and healthcare professionals. We will deliver patient through training. eCPO promotes the views and needs of people with obesity and acts as a bridge between the patient and clinical scientific communities. Our People First campaign that was launched at ECO Glasgow will continue. Next slide, please. Many eCPO representatives locally throughout the coming year. Our focus is on ECO-ICO next May 2020. We have patients on the organising committee, and patients will be involved in many sessions. We hope the People First campaign will have made changes in the language that speakers use when discussing people living with obesity. We are not obese subjects, we are people who live with obesity. It was hard to write some of this today because there is so much more what I could say, but also there's also so much that I don't know if I ever. It started as a whisper, and I'm doing my best to use it. If I can help one person not go through some of the negative experiences I did, then I feel it's worth the feelings of doubt and worry. And maybe in time that one person will help someone else too. Last slide. Thank you all for inviting me today.
Thank you, Susie. That was fantastic. Thank you so much. What a wonderful presentation. We are running a little bit short of time, but I think the one main question is, you know, many of the groups that World Obesity Federation, or many of the individuals, I guess I should say, the World Obesity Federation we've sort of come to World Obesity Federation through the portal, through our members outside of Europe and the US. There's not enough even understanding of obesity as a disease to even kind of conceptualize being a patient. It's at a very early stage. What are ways that yet we've got some wonderful people who have joined through our network, and particularly kind of our online community. Back to sort of the social media question, what do you think are ways that these patient communities can support one another, particularly in those places where there's just not enough sort of things are not developed enough to have a full-fledged patient group just yet?
I think, like Kirsty said, that it's webinars like this and raising awareness. And I mean, before today, I sent the link of this to patients I know here in Ireland, and we don't have a patient organisation yet. So while, you know, there's the level of eCPO working as a group, there's also the individuals who can be brought along by all of us. So it's including everybody. Social media is huge. We constantly have posts on our eCPO pages, and we can see the viewership increasing all the time, and people sharing it more. And yeah, so just sharing and doing what we're doing. As Kirsty said, it's a slow burn, but change is happening.
Excellent. We'll be sure to share all this information and details with all the groups that haven't joined yet, that aren't on the webinar today, but certainly also just post this all on our website and through our own social media channel. So thank you so much, Susie. Excellent presentation. And now it is my pleasure to introduce for the final few minutes of our webinar, Fiona Montague, who's Membership and Program Manager here at World Obesity Federation. We'll be updating you on the Global Patient Network, and particularly the work that we're doing with colleagues in the Middle East, North Africa, the Gulf region. Thanks.
Hello, can you hear me? Great. So thank you for listening. It's been really interesting hearing everyone talk. And I just, as Johanna said, just want to finish off really just very quick, talk about our global patient network that we've recently launched and how our MENA engagement program fits with that. So back in last year, we had our first Global Patient Summit in October at the same time as World Obesity Day. And this very much marked a new era, I think, for World Obesity in terms of our increased focus on patient advocacy and supporting people with obesity. Following this summit, a lot of recommendations came out of this, and we went forward to create the Global Patient Network. This is hosted on an online portal, and I guess this is a dedicated area for those living with obesity. And there are two sort of key objectives of this project. And the first is creating a hub, really, for the groups and societies of many we've heard of today, to bring people together on one platform to showcase what they're doing, to help share good practice, and for them to sort of share what they're doing, their resources and their events that are taking place. So obviously you can see there how you can join this as an organisation and get your details up there so people can link in with you. And I think secondly is really creating a platform for patients to share their stories, their journeys, access resources and get involved with our projects and our partners projects. So for example, our MAPS health systems project, you know, we're looking at health systems around the world, how people get access to obesity treatment. But we want to hear from patients as well as healthcare professionals. So it's really important we have this area that people can find out how they can get involved in these different projects. So if you haven't already, I do urge you that the URL is there. Do have a look and join up to the network so we can keep you updated. So we've heard obviously today from, you know, some regions from Europe, North America and India, some great work going on, particularly in sort of supporting people and patient advocacy. But there are other regions, such as the Middle East, where, you know, we know that prevalence rates are very, very high, but there aren't as many obesity organisations, and there is limited support at the moment for patients. So thanks for funding from J&J. This year we've been able to support and launch the MENA Patient Engagement Project. And what we're doing really here is work with our partners and key stakeholders in that region to increase and raise awareness of obesity, to increase that understanding and promote good practice, and also to enable people to discuss overweight and obesity and to share their stories. So how we've done this is really starting off as very much an intelligence gathering. I mean, here at World Obesity, we continue to survey and collect data around the world and prevalence rates. We've looked very closely at what's happening in the Middle East. We've then looked at the portal. We've created an Arabic version of the patient portal, so to try and increase engagement in that area. So everything you see in English will also be in Arabic. We're developing resources tailored to people in that region, such as handbooks, information sheets. And we're launching a media campaign. In fact, we had a first press release last month, some really good coverage. And we'll be leading up to a patient workshop in Oman at the end of this year. So again, we're urging people to connect up to this website, share their stories and talk to us about their weight. Just alongside this, World Obesity continues to work in the region with healthcare professionals and lots of different stakeholders, and we've developed the Gulf and Lebanon Steering Committee with a view of developing a regional society out in the region. We continue with capacity building, training up healthcare professionals, and our Scope School in Kuwait, I think, was our best ever. We had many hundreds of people attend that. Policy, we'll be looking at sort of helping and supporting what's happening with recommendations and guidelines. And our regional conference in Oman will be taking place at the end of this year. MENA engagement program is really important to us. So thank you for listening, really. All I can urge is get involved and go to our portal and look at what we're doing here. And that's it really from me. Thank you, Johanna.
Thanks so much, Fiona. That was excellent. And yeah, I had trouble hearing that last bit, but I think if we can send that around, the sound was quite faint. But again, thank you so much. And the work with our colleagues in the Middle East has been really rewarding. And and it's grown quite quickly. So we're very excited about what is developing there. Thanks very much. So again, thank you to all of our speakers. All of your presentations were excellent and really presented different dimensions of the role of people living with obesity in the overall sort of obesity community and agenda. So I want to really appreciate that. If you want to keep updated on the World Obesity Federation and the activities of our members and partners, do please sign up to our newsletter and watch out for updates on our website. Also remember World Obesity Day, which has until sort of the end of this year has been on in October. We've all now joined forces, these major organizations, OAC and European Association for the Study of Obesity and others, to have a new World Obesity Day, which will launch next March, on March 4th. Watch for all of in social media and through our newsletters for more information on this. And the role of patients will be, of course, incredibly important to that. We will send the link to this recording and slides shortly, so please do feel free to share with your colleagues. And then finally, I just want to say thank you, but want to just see we're actually over time, but if there are any final questions, I would welcome. I don't see any new questions here other than just people saying thank you, really, really good presentations. Okay, so I think we're covered, and as you know, just come to us at worldobesity.org for more information, and we are delighted that we will hold this presentation today. And oh yes, somebody actually did say it's the new World Obesity Day in March. Yes, that's correct. So for October this year, there will be some World Obesity Day activities, but not a huge theme. We have joined forces again, switching its Obesity Day, European Obesity Day, to March 4th with OAC, the Obesity Society, which have traditionally done Obesity Week in the sort of September, October, November time. We're all a single sort of day and week kickoff in March. So again, watch this space. We'll be sending out a communication about that. And we're very excited about it because we think it's going to only amplify and increase exponentially our effectiveness and reach and elevating obesity on the agenda, helping more and more and more people living with obesity to come out and stand together. Thanks so much, everybody, and we really appreciate your time. Thank you. Bye-bye.